Hi everyone, today I'm going to be talking about asthma. I chose asthma because a lot of my friends have it and I've always wondered what causes it, and it's also very common. Asthma is a condition in which a person's airways swell and become inflamed. This makes your lungs produce extra mucus, making it harder to breathe. It is a chronic restrictive disease, meaning it is something a person lives with every day. For some people, asthma can be minor, but for others, asthma can be very, very life-threatening. It can't be cured, but it is controllable. During inhalation, the lungs fill with air containing oxygen, which enriches the blood. During exhalation, carbon dioxide is expelled by the lungs. When mucus is produced, inflammation of the airways causes swelling and tightening of the smooth muscle around the airways. The airflow gets restricted, and the normal functions of the lung are affected, and breathing becomes really, really difficult. In acute asthma, the bronchial smooth muscle contracts quickly to narrow airways in response to exposure to a variety of stimuli, including allergens or irritants. Asthma can develop in both children and adults. The immune system views certain triggers as foreign materials and sends chemicals to fight them. If you have asthma, the chemicals will cause you to have an asthma attack. Asthma is not contagious. It is a respiratory air passageway disorder. The Mayo Clinic states that common symptoms of asthma include coughing, wheezing, which is really common at night, rapid breathing that causes skin around the neck or the ribs to pull in tightly, shortness of breath, fast heart rate, and chest tightening. Coughing can occur at night, during exercise, or during mild activity. Wheezing is most common with children, but frequent colds that settle in the chest are also a common symptom of asthma, although it is very, very rare. All of these symptoms can be very noticeable during any form of exercise or mild physical activity. According to the Asthma Clinic, there are many long-term medications that can be taken for asthma, such as cromolyn sodium and immune modulators. Severe asthma is treated with bronchial thermoplasty. This is when the doctor heats the inside of the airways in the lungs with an electrode. This is very painful and it's really uncommon, but it can happen in really severe cases of asthma. Inhalers are also a common and quick way to treat an asthma attack. Most athletes with asthma have to carry an inhaler with them everywhere they go, in case an asthma attack occurs during their sport. According to the American Lung Association, when you experience a trigger, the insides of your airways swell even more. This narrows the space of air to move in and out of your lungs. The muscles that wrap around your airways can also tighten, making breathing even harder. When that happens, it is called an asthma flare-up, asthma episode, or most commonly called an asthma attack. With asthma, your airways linings tends to always be in a hypersensitive state, characterized by redness and swelling, also called inflammation. It is similar to how your skin becomes red and irritated or sensitive after a really bad sunburn. So think of a sunburn on the outside of your skin. That is what the inside of your chest feels like, which sounds extremely painful. If asthma is left untreated, it can lead to airway remodeling, which is really uncommon, and this only happens if you have asthma really, really bad. And an interesting fact that I found out about asthma is that it's more common in males than it is in females, which was interesting because I've always heard of it as in females having it more than men. So I found that really interesting. But I hope you guys enjoyed my presentation.